Barriers for evidence-based practice in nursing. Nurses are the largest group of healthcare providers and have a key role in ensuring the promotion of healthcare and delivering the better services. So evidence-based, also we can call it as evidence-based practice. It is important to the professionals' development and responsibilities and capabilities of nurses, and has become an important subject in nursing and has integrated into the daily practices. In addition, the nurses who has practice based on the scientific evidence have been able to make better decisions in the services delivery. Though the nurses generally report the positive attitude and beliefs towards EBP. So evidence-based practice was known as evidence-based medicines in 1980s. Later on, the word changed into the evidence-based practice. The purpose was to identify the importance of scientific evidence in clinical areas. Evidence-based practice defined as is a problem-solving approach to provide the patient care based on the best available and valid evidence, leads to enhanced quality of care, reduced cost, and the individual and professional development of nurses and other healthcare workers. Increased expectations of high quality nursing care in the society, it is so longer acceptable for the nurses to deliver the nursing care based on only on experience and textbook knowledge. It is so limited, but to provide the quality nursing care based on the research findings, but it is still a gap between the existing between the knowledge of evidence-based practice and its implementations. The importance of EBP. EBP is essential for the nurses to build their body of knowledge and standardized practice to improve the patient outcome. And EBP helps the nurses to find effective treatment techniques, and it will help to implement the latest research methods in direct patient care and also the new contributions to the science of nursing. Lack of conducive teaching environment, the attitude towards the research, lack of knowledge of the research and specific low-level knowledge and compliance to evidence-based nursing practice, all these leads to be barriers for the quality health care. As a nurse, we have to provide high quality care to the patient, but because of some barriers, we are not unable to achieve 100% of evidence-based practice. Those barriers are the individual barriers and organizational barriers. Under individual barriers, lack of professional characteristics, lack of awareness, knowledge and skills, nurses' personal attitude and experience, and language barrier. Lack of knowledge and misconception about EBP, lack of knowledge mentors, nurses are not following the current ethics, lack of professional skills and clinical skills, lack of ability to access and assess the evidence, lack of ethical skills, lack of awareness and knowledge, and 83.7% of nurses are facing the lack of time to read the literature, and some of the not having the ability to work with the computers, and research reporters are not easily available. And some nurses are having the personal attitude and experience barriers. So those are pressure during the peer groups, and also lack of self motivation, difficulty in bring the changes, and lack of confidence in their ability to be physically active, lack of self management skills such as the ability to set the personal goals. Language barriers or lack of communication skills to express the knowledge, physical disabilities such as hearing problem or speech difficulties, language difference in the difficulty in the understanding unfamiliar accents. And also 62% of nurses are having the insufficient proficiency in the English language. Organizational barriers are lack of administrative support and supervision, lack of training and education, limited resource and time restriction, overwhelming of the patient's workload, lack of resource, search for uprise evidence, lack of workforce, lack of motivational incentives, lack of commitment from the managers and administrations, lack of time to implement the new ideas. Organization don't have to bring the new challenges in the organizational. So we'll see how to overcome those barriers in the organizational setup as well as the individual barriers. So organization has to take the initiation to improve the knowledge skills of the staff nurse by providing the in-service educations and staff development programs in the particular organization. And also organization and individual nurse should have a motivate the learn and to practice the evidence-based practices. As an individual nurse, everyone should have the interest to gain the knowledge related to new technology. And educational institutions should take the revolutions to provide high quality education, motivating the staff for continuing educations. Nurses has to collaborate with the clinicians, increasing the human resources, decreasing the overloads, providing the opportunities to learn the research findings. So nursing administrations and educators are responsible for the facilitating evidence-based practice and implementation. So the nursing administrators has to overcome the identify the barriers so that we can able to give the training and giving the education to increase the level of nursing knowledge in the institutional level, as well as they can able to improve the personal skills to use the evidence-based practices in the clinical setup as well as in the organization, those who are working in the institutional levels, so that the nurses can able to support the nurses with the resources requirement, and the providing the adequate supervision can facilitate the implementation of evidence-based practices, which will positively influences the quality care in the profession. Thank you. Please subscribe my channel.